In the wake of the tragic floods that have swept through Maiduguri, the Borno State capital, sweeping along its way human and properties and flood alike, a disturbing trend is emerging from the northeast state as residents are seeing drying out food-affected food items. And this trend has been observed by other residents who say they are worried about the quality of the food they will be buying from the market in the coming days and weeks. Now, this is in spite of a statement from the state government warning against it. Residents have been seen drying and repackaging food items recovered from flood waters. But medical experts are warning that this may trigger a health crisis. So tonight, let's speak with Dr. Salma Anas. She's a public health physician with over 30 years experience in public health program and interventions at both national and international level. She's also the special advisor to President Bola Tinubu on health. Good evening, Dr. Anas, and welcome to Politics Tonight. Thank you so much for joining us this evening.
Thank you. Good evening.
Good evening to you.
Nice meeting you again. Thank you so much.
All right. Thank you for joining us. You know, desperate but disturbing trends are beginning to emerge after the Maiduguri floods. Despite a statement from the state government warning against it, residents have been seen drying and repackaging food items recovered from flood waters. So, first, help us establish the severity of this situation.
Yes. Can you hear me?
Yes, I can. Please go ahead.
Yeah. Yes. Thank you so much. First of all, I still extend my condolences and sympathy to His Excellency, Governor Babagana Zulum, and the people of Borno State from suffering from this very devastating flood disaster, which we are witnessing, unfortunately, for the first time, I think, in Nigeria at this level and magnitude. So people were caught unawares by it, and people react differently. So we witnessed that, but I think most people are doing it out of ignorance. Drying of food, even drugs are being, they are drying the drugs and also exposing them to air and reselling them. But what we need to do an intensive awareness creation, education. We need to educate people on the implications of this, because the foods are already contaminated. The water itself is already contaminated with different kinds of things. Human beings are also there, dead bodies are there, animals are there, and several other contaminants are there. So people need to be well educated to understand that whatever is sucked in that water, flooded water, is already contaminated with all forms of bacteria, and then fungal infections, viral infections, different forms of contaminants, and even chemical contamination. The water is also polluted with different forms of chemicals. So there is need for intensive awareness creation. And I spoke this morning with the Commissioner of Health in Borno State. They are already doing that. They've already invited, also informed NAFDAC. NAFDAC is also already involved and doing a lot of awareness creation around the whole town of Borno State, so that people understand the implications of reusing food items, including drug items that have been already contaminated. And this is a continuous process that needs to keep on doing. We keep on doing that for some time.
So, what exactly can NAFDAC do in this kind of situation?
So, what we advise is that, of course, everything have to be sealed. All drugs that have been exposed, need to be destroyed. That's the best way to do it. It has to be destroyed because it can never be reused again. They have already been contaminated. And the NAFDAC Northeast Zonal Office is already on the ground in Borno State, working with the State Ministry of Health team and all relevant stakeholders doing that. And then even the drug sellers, the drug marketers, they are also being educated and informed on the dangers of doing so at the moment.
Right. You know, one of the reasons why medical experts like yourself advocate against eating food that has been exposed to flood is because of impurities like decomposed human and animal dead bodies, sewages and chemicals from hospitals and laboratories. But once these food items are exposed to the sun or even fire, for instance, Gary, would it not then be fit for consumption?
Everything that has been soaked in the water, in the flooded water, cannot be consumed again, because just like you rightly mentioned, they have already been contaminated. And remember that this is a very dirty water that has flown, you know, for all over the places and have taken all the debris and all materials along the way. Dead bodies, we've had all that, even animals have died there, and then human beings, and all kinds of waste, and also sewage. Some sewage have also taken, have flown into the flood. So it's really very, very dangerous. And then I was there in Borno State and I saw it, the very dirty water, muddy water with all kinds of debris and contaminations. So it's very important that people are informed about the dangers of using. And a lot of efforts are going on in the state to provide food to people, you know, to provide also clean water to people everywhere within the IDP camps and also within the communities and also homes. So people should have access to such, and they should desist from using all those contaminated water. And a lot of healthcare service deliveries also have also been established within the IDP camps, and also a strengthening of some of the facilities that exist within communities at the primary healthcare level and also secondary healthcare levels. So people should be informed and access such services that are made available to them during this period.
Dr. Anas, let's take a break, and when we come back, we will continue this conversation. Please stay with us, everyone.
The men that have been empowering Edo people. Who are the men that have been contributing immensely to the development of Edo State? Can I get a witness, somebody? Who are the men that have the drive and passion to make Edo great again? Here we have his 5-point agenda. 1. Water and food sufficiency. 2. Value-driven education. 3. Affordable healthcare. 4. Road development. 5. Security. They are confident and courageous. They talk less and do more. They have said it and they will definitely do it. Edo, let's come out come September 21st, 2024 and vote Senator Monday Okpewolu and Right Honorable Dennis Idahosa for Governor and Deputy Governor of Edo State. Vote APC.
This is Politics Tonight, everyone. Welcome back to the program. And I've been speaking with Dr. Salma Anas, Special Advisor to the President on Health, as we focus on the health implications of flood-affected food items. Dr. Anas, thank you so much for staying with us on the program. You know, in addition to all you said before we went on break, from research, consuming contaminated food can lead to waterborne diseases, food poisoning, gastrointestinal infections, and other life-threatening health issues. Are we ready for such health crisis?
Yeah, I've lost you briefly. So, but let me pick from what I had. Yes, one of the implications on health is of such disasters and flood from the contamination is waterborne diseases, foodborne diseases as well, because of all the contaminations, as we have earlier said, that can happen, and also pollution of the water itself. So commonly people will have gastroenteritis, diarrheal diseases, and from the contaminated water. And then cholera outbreak can also happen from this. Typhoid infection can also happen because of what is happening, and also because of the congestion of people, and also breeding spaces have also been provided for mosquitoes. You are also likely to have an increase of malarial infection in such a situation. So a lot do happen. And even as I said earlier, chemical contamination of water can also lead to several problems within the gastrointestinal systems, and also even respiratory symptoms. And in long time can lead to even cancers. So we have to be very careful, and we have to be on alert in terms of education of individuals, and ensuring that we provide the services at the right time immediately. And this is an immediate intervention that should take place, and it's happening in Borno. In Maiduguri, I saw it there happening. But a lot needs to be done, and there is need for a lot of support, especially in terms of providing more human resources for health to be everywhere. And they've embarked on even recruitment of retired healthcare providers, nurses, midwives, and also deployment. So a lot of people are helping. Volunteers are also helping to ensure that people are well informed and have access so that we avert any epidemic that can happen, because it's very risky to have such an epidemic at this very critical point in time. And the implication is very serious on the health of individuals, especially on the health of pregnant women and also on children under 5 years. It can be so devastating, and on elderly people. So there is need to intensify information to people, and also make the services available and ensure that clean water are available. Hot food, we also discourage the use of anything that is not hot at this moment. So hot meals should be served. People should avoid the use of anything that is not hot and well cooked at this moment of time, because some have even gone to the extent of reselling some of these dead animals in the market. So we have also encouraged that people should avoid the use of meat at this time, because you don't know where it is coming from until you are sure that it is fresh and slaughtered appropriately. But the best is that from the stories that we're hearing is that carcasses of animals that have died are also been, dead animals are also been in the market at the moment. So there is need for us to do so much to avert the immediate implications on the health of people, and also even the long-term implication. And with this also, you are likely to see even pollution of the air and its implications on the respiratory tract systems as well.
You know, talking about being careful, the question is to what extent, especially now that the state government has issued a stern warning stating that the public should desist from butchering, distributing, processing, selling, bullying, or consuming dead animals. You know, this warning came with consequences for those guilty or found wanted. According to the state government, anyone who violates this warning shall face the wrath of the law. But how far can this warning go in curbing this disturbing trend?
Yeah, I totally agree with the state government that this warning is on, and then there's need for enforcement of also the warning, you know, and most people are not aware. Just like I said earlier, a lot of people are very ignorant. So apart from the warning, there is need also to continue with an intensive awareness creation campaigns in communities, not only in the IDP camp, but also in the host communities and all the communities. And there is need for enforcement, and NAFDAC is also there working with the Ministry of Health to ensure that they also enforce such measures. But at the same time also accessibility, there is need for access, you know, to the needs. And the main need at this moment is food, water, clean water, and then toileting facilities. So WASH program, water and, you know, sanitation and hygiene is very significant at this moment. And that's why you need a lot of support. A lot of people need to come and support them. Volunteers, partners are also there supporting. So all people need to have their hands on it at the moment to ensure that the citizens of the state, the majority that are displaced, the people, everybody is affected, either directly or indirectly. And there is need for access to food, hot food, I mean meals for the people, and also access to clean water, drinking water, and also toileting facilities, and the environment needs to be clean because of the overcrowding. People are congested in one place, they've been displaced from their homes, and this is the first time we are witnessing such a massive displacement happening at the same time and affecting almost more than 70% of people residing in a specific community. So a lot needs to be done at the same time.
Dr. Anas, so realistically,
yeah,
you know, realistically, do we just prepare ourselves for a potential cholera outbreak?
Well, we should not rule out it can happen, but of course, all efforts are on the ground trying to avert the cholera outbreak. Because NCDC team, the DG NCDC was there personally, and he has also ensured that the rapid team response are there, building capacities of the epidemiologists and the health workers in Maiduguri to ensure that we avert. So surveillance system has already been set in place to monitor progress and to ensure that anything is reported, identified immediately, detected, early detection of diseases, and also reported immediately, and actions are being taken. So as we monitor the diseases occurrence, and also the surveillance systems are working, but we also ensure that the services are available, and also everything that is required for people in terms of hygiene and then sanitation is also available at the same time.